in information technology to better understand and analyze the wealth of data that is available about our country and its people. We need to address, yes, the culture of government. It has been several years since we introduced the Batupele principles, but adherence to these principles is inconsistent. The vast majority of public servants are very, very conscientious. They are honest and committed. But in too many parts of the state, the experience of our people leaves a lot to be desired. That is why we are working to do things differently, to promote efficiency, to encourage a culture of performance, and to find opportunities for public servants to deepen their skills as well as their experience. We have heard honorable members describe the situation in many of our frontline departments, those that provide essential services to our citizens. There are indeed areas of great concern, and these areas are matters that we want to prioritize. Our health system is truly under great strain. As the Minister of Health has said, the Public Health Service takes care of 80% of the people in the country, including large numbers of immigrants. We have nevertheless managed to initiate 4 million people on HIV antiretroviral treatment, deliver more than 1 million babies a year, and provide treatment to 300,000 people with tuberculosis annually. The increased burden of disease that our country is bearing now, and our attempts to treat as many people as possible, has increased the pressure on the public health system. One sees it as one goes to hospitals. Recently, I went to Tembisa Hospital, and just simply being taken to the neonatal side of the hospital and being told by specialists and doctors and nurses that they've run out of space, and almost 60% of the babies that are born, as I said earlier, are born to mothers who are from outside our country. Our country has become an oasis, not only for economic advancement, but also for health treatment. A ministerial team identified common problems in different hospitals around the country, primarily in human resources, financial management, procurement and the supply chain, as well as maintenance of infrastructure and equipment. The National Health Department is dispatching teams to turn around poorly performing hospitals. It is undertaking work to fill vacant posts and contracting private health practitioners to provide specific services. To reduce the burden of disease and therefore the pressure on clinics and hospitals, we are in the process of strengthening community-based health services. Madam Speaker, one area that particularly concerned honorable members was the report of the Auditor General that he has presented, where he said that there is a regression in the overall audit outcomes of municipalities in years 2015-16 and 2016-17. This reinforces the observation we made yesterday that there has been an increase in the number of municipalities that are in dire state. The Department of Cooperative Governance and the National Treasury have begun working together on a structured and coordinated approach to support financially distressed and dysfunctional municipalities. Working together with provinces Their joint response focuses on 3 of the 5 pillars of the Back to Basics initiative, namely institutional and administrative capacity, good governance, and sound financial management. Municipalities are being supported to implement robust improvement plans, which will be monitored closely by the departments. The departments are working to address the reality that, truth be told, some municipalities are failing at effectively delivering services, billing for services, and collecting revenue that is due. And some municipalities are municipalities that simply do not have a tax base and yet still have to provide services to our people. A simplified revenue plan is being implemented to improve revenue management, reduce municipal consumer debt, and enhance municipalities' revenue collection potential. This work will feed into and be reinforced by the Presidential Local Government Summit, for which preparations are underway. Honorable members, several speakers yesterday also raised the issue of violence and crime, which continues to deny our people the peace and the security that they deserve as citizens of our country, a peace they need and indeed demand. As we indicated yesterday, we have made several important appointments to strengthen police management, including the appointment of a new Divisional Commissioner for Crime and Intelligence, and yesterday, a new head of the Hawks. It is hoped that these critical appointments will strengthen the criminal justice cluster, and the police will be able to infiltrate syndicates and arrest syndicate members, particularly those who are involved in organized crime and those who are now perpetrating these cash heists all the time. The Minister of Police has instructed the police management to conduct preventative crime intelligence-driven operations in dealing with serious and violent crimes such as armed robberies, cash heists, and murders. I have appointed an interministerial committee comprising of Ministers of Defense, Police, State Security, and Justice to address the problem of political killings in KwaZulu-Natal. The IMC has begun meeting key stakeholders in the province and is expected to present a comprehensive report by the end of the month on measures to end these killings and to bring those who are responsible for these killings to book. From all these contributions yesterday, Madam Speaker, even from among the doubters, it is clear that we have entered a new era. It is a new era that holds much promise for renewal, growth, and transformation, but it will only succeed if we all work together to make it a true reality. It will only succeed if we put aside our narrow interests and pursue the shared future that the people of this country desire. Ons is almal Suid-Afrikaners, wat hierdie land saam moet bou. Sisonke sifanele ukuthi sakhe iNingizimu Afrika. We are all South Africans and we have a common responsibility. I wish to conclude by expressing my gratitude to ministers in the presidency, Minister Dlamini Zuma and Dlamini, as well as the DG, Dr. Cassius Lubisi, Acting DDG Busani Ngaweni, my advisors, secretariat members, staff, directors, protectors, for enabling me to do this work. Lastly, and it is a pity that Honorable Malema is not here, I wish to thank my family and my wife especially, and to inform Honorable Malema, that the First Lady had a knee operation almost 3 months ago. And she had a knee operation called arthroplasty, something like that. She has not been able to walk properly for the past 3 months. And later she started walking on crutches, and now she has started walking on her operated foot. So, Honorable Malema, there is nothing wrong. She has just not been well. She will soon be making her contribution, particularly in her area of speciality, early childhood development. And Honorable Malema, I therefore invite you to visit some early child development center where you might be able to meet